I am often surprised about the number of people that I run into that have never heard of stem cell before. I actually have taken my own little survey before and found that when somebody's dealing with an ailment or some condition, I mentioned to them, have you thought about stem cell? And they have not. Perhaps it's because their doctor has told them to specifically do something that they feel is right. And stem cell could be the answer for them. Now, let me just say that people who know me know that I like to do things naturally. I try to avoid prescription medicines. I try to avoid surgery. There are things you can do out there naturally, but I'm very careful about undermining what a doctor might tell you. If the doctor says you have high blood pressure and you can't find a solution naturally, you have to go with what the doctor tells you because you want to take care of your body. You want to do the best thing for your body, even if it's for the rest of your life you're taking a prescription medicine. But again, there are certain things you can do that might make a difference, and stem cell is one of them. Let's take a minute and talk about what stem cell is. First of all, stem cell is something that was not available to the American culture up until maybe 5 or 10 years ago. It was Western Europe. People were going to Western Europe or to Asia to get their stem cell. And today, this is now available to us. And there are certain things that you need to know about it to make sure that you're doing the right thing, though. First, before I tell you about what stem cell is, let's talk about the cells in our body. We have billions of cells in our body. Billions. And those cells help to repair, rebuild tissue, help with chronic issues. They do everything. And there are a lot of more good cells than bad cells, but there are bad cells as well. There's actually cancer cells. We've been told that everybody has a little bit of cancer cells in them. So you want to have more of the good cells, of course. And what they do is they're like the front lines. They go to the areas that are affected, and they will start like taking care of those areas that are affected. But the stem cell is different. The stem cell is like the brains. They're the ones that tell the cells where to go, where the needs are. So they'll go and send off signals to the cells to make sure they're going to the right place. When you're first born, you have about 1 out of every 100,000 cells are stem cells. By the time you're about 50 or 55, you have about, wait a minute, let me get this right. You have 1 out of 100,000. By the time you're 50, 55, you have about 1 out of every 500 cells, 500,000 cells that are stem cells. So that's a big difference. We don't have as many stem cells to work with. So to get stem cells back in your body is going to be a great thing and probably might, in a lot of cases, help your situation. There are numerous things that it takes care of, but one of the things that you want to keep in mind, I would Google, go to the internet, find out a local doctor there that does stem cell. They do have to be certified. Find out from them what kind of cells they're using, where they're harvested. That's really important, how good they are. These days, a lot of people are, women who have babies will, it's called embryonic stem cell, and they will save their placentas, and they'll freeze them and put them in a bank. And when somebody in the family gets ill, then there's genetically more of a match for the stem cells, because not all stem cells are right for a certain area. So you have to have the right stem cell for a specific thing. And some of the things that stem cell works on is, for instance, a lot of people have knee or neck injuries, things like that. It's hard for them to walk. To get an injection with stem cell sometimes can turn the corner. I mean, we're talking about really rebuilding tissue here. It's kind of the coolest technology. So that's something you want to keep in mind, but I want to share something else with you that might be more helpful. First, I want to tell you the negative side to stem cell. The negative side to stem cell is, well, one is it's possible it doesn't work. Even if you've done all the research and you know, doctors will tell you that it probably will do something for you, it's possible it may not have any effect. The problem is that it's expensive. You'll spend at least $5,000, probably closer to 10, and in some cases upward of 20. So it's very expensive, and insurance companies, very rarely do insurance companies cover it right now. I think someday they probably will. So another solution might be, it's called PRP, it's plasma-rich platelet therapy. And plasma-rich platelet therapy is, all they do is they take the blood, your blood, they put it in a centrifuge, and they spin it, and they take the thousands of cells that they have, and they produce hundreds of thousands of cells from going through the centrifuge. And then they put it back into the affected area. So my story is about, I want to say several years ago. For years now I've been dealing with something in my neck. I've had an MRI done. I definitely have some disc issues. And I've tried, I don't want to have surgery. I mean, I'm trying my best not to have surgery. So I went and I found a doctor, recommended doctor, who did stem cell and PRP. And when I went to see him, he looked at my MRI and he said, I'm going to tell you that stem cell may not work in this case. But he said, it's worth it for you to at least try PRP. So we went in, he did it for me, and it's been almost 2 years now, and it feels great. He told me that it probably only lasts 6 months. And for me, the cost was, we did 6 shots, 6 injections, and I'm going to guess that I could have probably done less, maybe 3 or 4, and they were $250 a piece. So that's like, it was like less than $1,800 to have the PRP done. And again, I could probably do that every 2 years and be very happy about it. So it was very successful. I also have another situation. A friend of mine had tennis elbow, and I had tennis elbow 30 years ago, 3 times in a 5-year period, and it took 6 months for recovery. They went in, got 1 shot of PRP, and they were back on the court in 2 weeks and felt great. So I'm trying to tell you that there are ways to do things. Now what I'd like to do is, some of you who are watching this video might have some experience with it. Please share it with us. If you like this video, great. If you want to share it, great. If you would, subscribe. Just click the button above and let us know your thoughts. And also, if somebody else is on and they are looking for doctors, referrals are really important to me. So if I can get a doctor that somebody's referred to me, it makes all the difference in the world. And so if you know somebody in your area, in every big city, you're going to find stem cells. So all you got to do is Google it, you'll find it. And PRP. So either one. So you might know somebody that you can help somebody you've had an experience with a doctor, or have them shy away from another doctor. And that way, if you could, we all want to help each other. So subscribe for me, and enjoy. I hope you enjoyed this video, and we'll look forward to the next one. Have a great day. Thank you.